Hello, we from SGD B4 will present our student project on the topic of Gynecomastia. These are the names and student numbers of our group members. Chapter 1, Introduction. Let me introduce myself. My name is Igu Silana Agung Librowan Dharma Laksana with three last digit of student number R029. I want to explain about introduction of our student project. Gynecomastia is a condition of unilateral or bilateral enlargement of breast tissue in men. Gynecomastia occurs due to hormonal imbalance, either due to physiologic or pathophysiological causes. Gynecomastia can resolve spontaneously, but some are reversible and require medical assistance, either medication or surgery. In general, the highest incidence of gynecomastia occurs during puberty, around the age of 14 years, but older people, age 50 to 69, can also experience it. In Indonesia, there is no exact data on gynecomastia cases. Based on the background information before, the problems that need to be addressed are: what is the definition and types of gynecomastia? What is the epidemiology and etiology of gynecomastia? What is the pathophysiology and histopathology of gynecomastia? How to diagnose, manage, and determine the prognosis of gynecomastia cases, and how to prevent gynecomastia. Based on the problem formulation before, the objective of this student project are to understand the definition and types of gynecomastia, to understand the epidemiology and etiology of gynecomastia, to understand the pathophysiology and histopathology of gynecomastia, to understand the diagnosis, management, and prognosis of gynecomastia, to understand the prevention of gynecomastia. The benefits of this student project are to understand more about gynecomastia in order to improve medical knowledge on this topic. That's all from me. The next will be explained by my friend. Thank you.
The next chapter will be presented by me. Chapter 2, Content. First of all, let me introduce myself. My name is Niluputu Mahaputri Kaika with the last three-digit number 155. Ontogeny and hormonal regulation of breast development. The growth of male breast occurs in similar way to female breast. Mammary glands are a modification of sweat glands which initially appear as the bands of thickening of the epidermis called mammary lines or mammary ridge. The line in the thoracic region will penetrate into the mesenchyme to form epithelial buds, which then form into the lactiferous duct, and the duct will form into nipple after birth. Estrogen promotes ductal growth, meanwhile progesterone promotes alveolar development. Aromatase catalyzing the conversion of C19 steroid into estrogen. Therefore, abundant testosterone or increased activity of the enzyme aromatase can increase the production of estrogen. Androgen can stimulate breast development if they produce aromatization of estrogen. This case occurs in the case of excess androgens or increased activity of aromatase.
Hello, my name is Gustiago Ngadita Dharma with my last digit of name is 087. Now I will explain about the definition of gynecomastia. Gynecomastia is a condition where male breast enlarge due to benign proliferation of glandular tissue of the breast. Gynecomastia comes from Greek words, namely gyne, which means feminine, and mastia, which means breast. Gynecomastia generally occurs idiopathically, but there are also several other things that can cause this condition, such as obesity, hypogonadism, liver and kidney disease, and use of steroids. Gynecomastia commonly happen when hormonal changes occur in the body, such as at birth, adolescence, and old age. That's all from me. Thank you.
Hello, my name is Fauzan Azimamika Javani with the three last digit of my student number is 131. So the epidemiology of gynecomastia, it can appear transiently in neonates due to the mechanism of maternal estrogen influence, with reports indicating its occurrence as many as 60 to 90% of newborns. And similarly, the process of hormonal changes starting at puberty trigger gynecomastia in about 50 to 60% of adolescent boys, predominantly between ages 13 to 15, and the conditions also increase its prevalences among older male population, impacting 50 to 70% of those aged uh, 50 to 69. Thank you.
My name is Rusanya Trikira with last 3 years of student ID number is 199, and today I would like to talk about etiology of gynecomastia. The cause of gynecomastia is idiopathic, but it has been linked with hormonal imbalance of testosterone and estrogen. Men that's older than 65 years old are suspected of having gynecomastia because of the decreasing testosterone, and they are more likely to consume drugs that would cause this condition. In adolescent boys, this condition happens because of testosterone and estradiol hormone imbalance. There are medications that could cause gynecomastia. Um, it includes thiazides, estrogens, theophylline, phenothiazine, finasteride, ketoconazole, spironolactone, cimetidine, digoxin, and marijuana. And there are also medical conditions that can induce this condition, and it includes hypogonadism, breast cancer, obesity, thyroid disease, adrenal disease, cirrhosis, malnutrition, and renal failure, and tumors in pituitary, testings, lungs, and adrenal glands. Thank you.
Okay, first of all, let me introduce myself. My name is Franciscus Asisi Tokan with the three last digit of my student ID is 092. Okay, for the pathophysiology and histophathophysiology of gynecomastia. So, normally male breast tissue has the receptor for both androgen and also the estrogen. While estrogen will help to promote the breast growth, the androgen will help to inhibit it. So, main problem or most common problem about the gynecomastia mostly happen because of the imbalance of this both hormone. It can be either by low androgen level or high estrogen level, and it can be just the problem of the hormones work overall. And for the histopathophysiology findings of gynecomastia depends on how long has the condition occurred. For the case of less than 6 months, there can be finding of florid pattern with increased cellular activity and findings of growth of duct lining. And for the cases above 6 months, there can be findings of fibrous pattern where the glandular tissue shrinks and replaced by fibrosis and fat, and this is often irreversible.
Okay, let me introduce myself. My name is Pursatya Wijaya with last three digit of student ID number 227, and I would like to explain more about the types of gynecomastia. Based on how long a patient has developed the condition, gynecomastia can be classified into three different types, namely, first, florid gynecomastia, characterized by a rise in ductal tissue and vascularity. This type is typically observed in the early phases of the condition, 4 months or less. Second, intermediate gynecomastia, also known as a phase between florid to fibrous gynecomastia, and often manifests starting about 1 year after the onset of gynecomastia. And third, fibrous gynecomastia, characterized by an increase in stromal fibrosis and fewer ducts. This type often manifests itself after a year of progression. Gynecomastia can also be classified based on the degree of skin excess and breast enlargement, namely grade 1, small enlargement with no skin excess, grade 2, moderate enlargement with no skin excess, grade 2B, moderate enlargement with skin excess or extra skin, and grade 3, marked enlargement with extra skin, also bearing a similarity to female breast ptosis appearance. Additionally, based on the etiology, gynecomastia can also be differentiated into physiologic gynecomastia, associated with normal hormonal changes during birth, puberty, and old age, drug-related gynecomastia, and gynecomastia from underlying medical problems. That's all from me. Thank you.
Let me introduce myself. My name is Bonifacio Salavento Satara Pamungkas with last digit of student number 137. In this occasion, I want to explain about the diagnosis of gynecomastia. The first of all is from the aspect of history taking. The history should cover factors like age of breast growth, onset nipple changes, and potential causes such as weight fluctuations, drug use, testicular damage, alcohol and drug usage, and family history of related conditions. And the second one is the physical examination. Physical examination focuses on breast size, consistency, nipple discharge, and lymph node swelling. Differentiation between true gynecomastia and pseudogynecomastia involves specific techniques. Breast cancers signs include unilateral hard lumps with skin changes. Examination also includes abdomen and testicles. Thank you.
My name is Firman Berbudianto with TILAS number 161. Now explain about the management of gynecomastia. The management of gynecomastia involves a comprehensive and tailored approach to address the underlying causes and symptoms associated with this condition, such as identifying and treating any hormonal imbalance or systemic disorders contributing to gynecomastia. Discontinuing medication known to induce gynecomastia is another important aspect of management whenever feasible. This discontinuation allows for the reversal of the underlying mechanism. However, in cases where gynecomastia has persisted for more than 6 months, regression might be less likely due to the presence of fibrotic tissues that are less reversible. In cases where a breast biopsy indicates malignancy, mastectomy may be necessary for therapeutic purposes. Close observation through regular breast exams every 3 to 6 months is recommended, particularly when no clear pathological etiology is identified. Medical intervention may be warranted in certain cases, and several classes of medication can be considered, including androgens, antiestrogens, and aromatase inhibitors. Surgical intervention becomes necessary when medical therapies fail to produce desired outcomes or in cases of severe or long-standing gynecomastia. Surgical procedures typically involve the removal of glandular tissue, if often in combination with liposuctions if needed. Surgical treatment is usually postponed in cases of pubertal gynecomastia until after puberty to minimize the risk of recurrence. That's all for me. Thank you.
Angela Emma's student ID number is 21025 11 So gynecomastia usually has a good prognosis with appropriate treatment. In 90% of pubertal gynecomastia cases, the glandular component of the breast may simply diminish by itself. However, it may also indicate underlying diseases such as testicular neoplasm and Klinefelter syndrome. Patients often feel distressed and embarrassed about their body image, making social interaction difficult. Nevertheless, in Klinefelter syndrome, the extra X chromosome increases the risk of breast cancer, making gynecomastia treatments a necessity for prevention rather than aesthetic reasons.
Okay, thank you for the opportunity. And firstly, let me introduce myself. My name is Madedanta Widarta with my last three-digit number is 147. And I'm going to talk about the preventions for gynecomastia. So gynecomastia often arises from hormonal imbalances. So in high-risk patients, particularly those undergoing non-steroidal anti-androgen therapy and androgen deprivations for conditions like prostate cancer, require preventive measures. These include tamoxifen, radiation therapy, and aromatase inhibitors. However, among these, tamoxifen is considered to superior for both prevention and treatment for gynecomastia. But its side effects, such as dizziness and hot flashes, should be monitored and considered. That being said, for initial prophylaxis, it can start with radiation therapy, but also consider to follow it up with tamoxifen if radiation it proves ineffective or causes side effect. Okay, that's all from me. Thank you.
Next, Chapter 3 summary will be presented by me. Let me introduce myself. My name is Zafira Kumaladewi with last three digit of student number is 122, and I will continue the explanation about conclusion and suggestion. First, conclusion. Gynecomastia is a condition of enlargement of male breast due to benign proliferation of tissue of the breast. The prevalence of gynecomastia varies among different age group, and it is common in newborn due to the influence of maternal estrogen and in adolescent during puberty. It is also prevalent in older men. The cause of gynecomastia is often hormonal imbalance with testosterone deficiency or high estrogen levels being the common factors. Gynecomastia can be diagnosed through a thorough medical history and physical examination. Mammography and ultrasound are imaging techniques used to distinguish between benign and malignant breast disease. Laboratory tests may also be conducted to rule out underlying medical condition. Generally, the prognosis of this condition is good and mostly diminished in pubertal gynecomastia. Gynecomastia can be prevented by tamoxifen, radiation therapy, and aromatase inhibitor. The management of gynecomastia involves a multi-phase and customized approach to the individuals. Next is suggestion. More research need to be done to reach our understanding of gynecomastia. Emphasizing gynecomastia is important to raise awareness in understanding and managing this disease. With the addition of this literature, it is hoped that readers can understand the definition, epidemiology, etiology, pathophysiology, types, diagnosis methods, prognosis and treatment management of gynecomastia. Well, that's all from SGD B4. Thank you for the attention.